Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Today, we would like to explain about medical discourse analysis. We are from the last group, which consists of Ananda Felin, Lutfian Hadiarso, and Ahmad Imam Murshid. There are 6 points that we will discuss today. The first is what is medical discourse, the second is illnessing, the third is patienting and doctoring, the fourth is widening out the realm of medical discourse, the fifth is recent research on medical discourse, and the last is quiz. Please pay attention to the presentation because you will have quiz in the end of our discussion today. Thank you.
The first part is the definition of medical discourse. Medical discourse is the discourse in and about healing, curing, curative practices, speaking, and writing that can help medical institution and social action. This includes therapeutic interactions such as psychotherapy and physiotherapy, and interactions among medical professionals in treating patients and training future members of the field. Medical discourse itself has an important role in medicine and has profound significance of shaping and constructing our most internal experiences, be it personal, psychological, or sensory experience, whether it be a discursive process with friends, family, doctor, nurse, technician, or even ourselves. Together, speech, gesture, posture, and other acts produce meaning in medical interaction. Thus, the scope of medical discourse also includes nonvocal communication. Those nonvocal interactions are namely 1. Patient positioning themselves to make body parts visible to physicians. 2. Senior surgeons using gestural as well as spoken signs to teach medical school students about the currently problematic body part and get the ongoing activity. And 3. A junior member of an anesthesia team points to the knob that increases gas flow, eliciting a go-ahead nod from a senior member. The second part is illnessing. Medical discourse properly starts with a focus on one's initial experience of a symptom instead of doctor-patient communication. That is the moments when one is figuring out if they are sick or not, or sick enough to see the doctor, and so on. In other words, illnessing is the process where before going to a doctor, patients attempt to determine whether their symptoms are worthy to be brought to a physician's attention. Patients want a diagnosis because of 3 reasons, which are 1. They hope that diagnosis will bring remedy and treatment for the illness. 2. The advantage of a disease category in describing one's condition for others. And 3. The diagnosis provides a sense that one is living in an orderly world, that one's condition can be located in medical indices and libraries, that others share the condition, and especially that one is sane. Patients want a diagnosis because of 3 reasons, which are 1. They hope that diagnosis will bring remedy and treatment for the illness. 2. The advantage of a disease category in describing one's condition for others. And 3. The diagnosis provides a sense that one is living in an orderly world, that one's condition can be located in medical indices and libraries, that others share the condition, and especially that one is sane. In doing the process of illnessing, patients use discursive resources. These are a set of significant questions, potential answers, and procedures for arriving at answers that each culture provides its members with. Patients utilize discursive resources to work through the realm of possibly being ill, that is to transform from being well to being ill. The set of questions someone asks themselves in the realm of possibly being ill has been termed the patient's problem by Halkowski, which are 1. Is this a potential health problem or part of the everyday sensations, aches, etc. that come with having a body? 2. Is this something that I need to deal with or something that will resolve itself? 3. Should I consult a professional about this or manage it myself? 4. If I treat this, how should I? And 5. How long should I try to manage this before I go to a doctor? Medical discourse provides the resources for patients to understand their problem with friends and relatives and also to themselves. Knowing about their illness is not merely reassuring to patients. It also allows the patient to provide a good account of their illness to others and themselves.
Patienting and doctoring. Patienting and doctoring is a struggle to build a doctor and patient relationship. This is an emotional association between the doctor and the patient which arises when the doctor interacts with patients to alleviate their sufferings and prevent illness. This is important because it can improve treatment compliance of the patient, avoid unnecessary intervention, and prevent misunderstanding, errors, and conflicts. Model of relation between doctor and patient. There are four models of relation between doctor and patient. The first one is deliberative. This takes the concept of doctor as a friend, so patient can talk with doctor casually as a patient tells his friends about his feeling and pain. The second is interpretive. In this case, the doctor is seen as an advisor. The doctor gives advice to the patient about how to have good healthy and how to revive from their illness. The third is paternalistic. The doctor in this case seen as a father. So the doctor gives main attention to his patient like father gives attention to his child. The last one is informative. The doctor gives only facts. These models are based on patient decision because if the patient are not understand, he will shocked and stressed. Be competent patient. This is how you can be a competent patient. The first one, do not panic and search for information that you need. Second, as a patient, we should keep calm and patient. The third, it will be better to us to study medical terms independently. The next one is do not shock and stress when the doctor explains about your illness. We need to ask what we do not know or we do not understand. The next, keep in touch with your doctor and always consult with your doctor. And the sixth, follow your doctor instruction to get healthy as soon as possible. Good doctor. There are some criteria that show that they are good doctor. The first one, good doctor always understand patient's emotional condition and they never use rough words for patient. The second, they never forget to support their patient. The next, good doctor always give patients time to understand their healthy condition. And the last, they give the best struggle to patient.
The third is widening out the realm of medical discourse. Realm of medical discourse is developed by paying more systemic attention to the fact that a doctor-patient encounters is often doctor-patient and patient-family members encounter. This move from two to three parties qualitatively transform any encounter. Stivers has researched on this topic and drawing out much needed attention to the ways that doctor child-patient and patient-parents encounters are methods to gradually bring the child into full participation and competence as a patient. On the other hand, it is still needed more research on doctor, elderly patient, and adult child of patient encounters on how the delicate issues regarding the diminution of the patient participation and competence are managed. In medical discourse, there are parts of discursive practice that are speaking about and speaking behalf of that constitute the interactants' relation to each other. Recent research on medical discourse. The first is Charles Goodwin. Charles Goodwin has researched on how patients with particular brain injuries retain, find discursive and interactive methods to make sense with and of each other. The second is Wayne Beach. Wayne and others investigate on how family members and friends of patients interact with each other and about the patient and his illness. This research found that illness may affect the circle of people. This is the end of our presentation today. Please answer the questions below and submit it in our WhatsApp group. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.